Hello and welcome to PodcastDX, the show that brings you interviews with people just like you, whose lives were forever changed by a medical diagnosis. I'm Lita. Ron will not be with us today.
And I'm Jean Marie. Today we're talking about a very important and major health topic, lung cancer.
Lung cancer is the second most common cancer in both men and women, and it's the leading cause of cancer-related deaths worldwide. But understanding what types exist, how they behave, and how they're found is the first step toward prevention and treatment. Lung cancer starts when abnormal cells grow uncontrollably in the tissues of the lung. Instead of dying off like normal cells, these damaged cells multiply, form tumors, and interfere with breathing and oxygen exchange.
Most lung cancers begin in the lining of the airways, the bronchi or the bronchioles, but can spread to nearby lymph nodes, the brain, the liver, bones, and other organs. The sooner it is detected or found, the more options doctors have for treatment.
There are two broad categories of lung cancer: non-small cell lung cancer and small cell lung cancer. Together, they make up nearly all cases.
Non-small cell lung cancer, or NSCLC, accounts for approximately 85% of all lung cancer cases diagnosed. It's generally slower growing and more likely to be caught or detected early.
Non-small cell lung cancer, or NSCLC itself, has three major subtypes: adenocarcinoma,
or adenocarcinoma,
squamous cell carcinoma, and large cell carcinoma. Adenocarcinoma starts in the mucus-producing cells and often appears in the outer parts of the lungs. It is now the most common type, especially among people who have never smoked. Squamous cell carcinoma begins in the flat cells lining the airways. It's typically linked to smoking and found near the center of the lungs. Large cell carcinoma can appear anywhere in the lung and tends to grow and spread quickly.
The other major type of lung cancer is small cell lung cancer, or SCLC, and it makes about 10 to 15% of cases that have been diagnosed. It's more aggressive. It spreads early and widely, but it does tend to respond well to treatment, at least initially, such as chemotherapy and radiation.
There are also rarer forms like lung carcinoid tumors and sarcomatoid carcinoma. Carcinoid tumors tend to grow slowly and may secrete hormones that cause unusual symptoms.
Some cancers found in the lungs aren't technically lung cancer. They're metastases from other organs. For example, if you have breast cancer, colon, kidney, or thyroid cancer, and then they metastasize into the lungs. Healthcare providers can tell if it's what kind of cancer it is by examining the tumor cells under a microscope and identifying their origin.
Once lung cancer is diagnosed, doctors assign it a stage, which describes how far it has spread. For non-small cell lung cancer, stages range from 1 to 4. Stage 1, it's confined to one lung and it's small in size. Stage 2, it may have reached nearby lymph nodes or structures. Stage 3, there's more extensive regional spread. And stage 4, cancer has metastasized to other organs.
For small cell lung cancer, healthcare providers use a simpler system, limited stage or extensive stage, depending on whether the disease can be treated with a single radiation field or not, or within a single radiation field.
Staging determines the treatment plan and helps estimate prognosis. Early stage disease may be curable, while advanced stages often focus on controlling growth and symptoms.
Diagnosis begins with imaging, typically a chest x-ray followed by CT scans or PET scans for more detailed analyses. And then suspicious areas may be biopsied, and this is when a small sample of the tissue is examined under a microscope. So a small portion of the tissue is removed, and then, you'll go into that more.
That biopsy can be obtained several ways: via a bronchoscopy, needle aspiration, or occasionally surgery. Once the tissue is collected, pathologists determine the type, grade, and whether genetic mutations are present.
Genetic testing, called molecular profiling, has become a cornerstone of modern cancer care. Certain mutations like EGFR, ALK, ROS1, and KRAS can guide treatment decisions because of the specific drugs that target those pathways.
Exactly. Lung cancer isn't just one disease anymore. Knowing its molecular fingerprint helps match the patients with the most effective therapy.
So far, we've only spoken about what lung cancer is, its main types, and how doctors typically identify and stage it. But now we'll talk about maybe some treatment options.
Sure. Treatment options range from surgery and radiation to immunotherapy and targeted drugs. How the choice depends on the type and stage of the disease.
Treatment varies based on the type of lung cancer one is diagnosed with and the stage or progression the disease has reached. So, and it also might vary based on a person's overall health and other healthcare conditions. Typically, the main goal is to remove the cancer, if that's possible, to control its growth. And if it cannot be removed, then to mitigate symptoms and maintain the highest possible quality of life for the individual.
When lung cancer is found early, surgery can be curative. At later stages, the approach usually combines radiation, chemotherapy, immunotherapy, or targeted drugs to keep it under control as long as possible.
Surgery is most common for non-small cell lung cancer in stages 1 or 2. The goal is to remove the tumor and a margin of healthy tissue around that area or that tumor.
Right. Procedures include a lobectomy, which is removing one lobe of a lung, segmentectomy or wedge resection, which is smaller sections, and pneumonectomy, removing an entire lung. Modern techniques like VATS, video-assisted thoracoscopic surgery, and robotic methods let the surgeons operate through tiny incisions with faster recovery.
Surgeons also check lymph nodes typically to see if the cancer has spread. That helps determine whether additional therapy is needed after the surgical procedure.
Right, and we're going to be talking about the lymph system next week.
Okay.
Radiation uses high energy beams to kill cancer cells or shrink tumors. It's often used when surgery is not an option or to destroy remaining cells after surgery.
External beam radiation is most commonly used. Stereotactic body radiation therapy, or SBRT, delivers precise, high doses to small tumors in fewer sessions. Great for early stage patients who can't undergo surgery or for whom surgery is not a viable option.
Radiation also relieves pain or bleeding caused by tumor pressure, which is a key part of palliative care.
Chemotherapy uses drugs that circulate through the bloodstream to kill rapidly dividing cells. It's also often combined with surgery or radiation.
In early stages, it's given after surgery. It's called, how do you say that? ADJUVANT.
Adjuvant. I don't know
It's
why.
therapy that goes along with. That's
Yes.
basically what it means.
Yes.
To eliminate microscopic cells. For advanced stages, it may be used to shrink tumors and control symptoms.
And there are different medications or drugs that are utilized, and your healthcare provider may alter those based on what the specific type of cancer, the location, the extent, or the stage. Because these medications also affect normal cells, side effects include or may include fatigue, nausea, hair loss, and potential infection risk. Supportive medications and care strategies can help mitigate these additional issues and make it more manageable than it was in the past.
They're learning.
Yeah, and I know that, supplying like ice packs can help, and, different things to make you more comfortable during the procedure, and, for hair loss, if you want to utilize, there's different options there too.
This is where personalized medicine shines. Targeted therapies focus on specific genetic mutations or proteins that help the cancer cells grow. Examples include EGFR inhibitors, ALK inhibitors, and KRAS inhibitors for certain mutations. Instead of killing all fast-growing cells, these drugs block the abnormal pathways that are driving the tumor. Patients undergo molecular testing to see if their tumor matches one of these targets. If it does, the results can dramatically extend survival and reduce side effects compared to traditional chemotherapy.
Immunotherapy uses the body's own immune system to recognize and attack cancer cells. Checkpoint inhibitors block signals that cancers use to hide from immune cells.
They become standard for many patients with advanced non-small cell lung cancer and some with small cell disease. Side effects can include fatigue and inflammation of organs like the lungs or thyroid, so close monitoring is essential.
Healthcare providers often combine different approaches, for example, chemotherapy plus immunotherapy, to maximize the effect. After tumors shrink, patients may stay on a single medication long-term to keep the disease under control.
And this maintenance phase helps prevent recurrence and can extend remission for months or even years.
Palliative care isn't just for end-of-life patients. It also can help to relieve symptoms and improve comfort, as we were talking about before, like with ice packs, at any stage. Managing pain, shortness of breath, fatigue, or even just the emotional distress.
Okay. And studies have shown that patients who receive palliative care actually live longer and have better quality of life. It's about treating the person, not just the tumor.
For some patients, clinical trials offer access to emerging treatments that are not yet widely available. New targeted agents, vaccines, and even cell-based therapies may be on the frontier and available.
Trials also help scientists learn which treatments work best for which tumors. Participation is voluntary, but highly regulated for safety.
And we've outlined the major treatment options for lung cancer: surgery, radiation, chemotherapy, immunotherapy, and targeted therapy, plus the support systems that can make it all more comprehensive.
Well, I think we should now shift to prevention.
Great idea.
How to reduce your risk of ever developing lung cancer in the first place. We'll cover smoking cessation, environmental exposures, and early screening. We should focus on prevention, how to reduce the risk of developing lung cancer in the first place when possible. While not every case is preventable, many risk factors are within our control.
The number one cause of lung cancer is cigarette smoking or vaping, according to the CDC. It's linked to about 80 to 90% of all lung cancer deaths in the United States.
Tobacco smoke contains more than 7,000 chemicals, and at least 70 of which are known carcinogens, substances that cause cancer. These chemicals damage the DNA inside the lungs, and over time, those damaged cells can grow uncontrollably.
The good news is that it's never too late to quit. Within weeks of quitting, lung function improves. Within a year, the risk of coronary heart disease is greatly or vastly reduced. And after 10 to 15 years of smoking cessation, the risk of lung cancer drops by as much as 50% compared to someone who continues to smoke.
That's a powerful message. Help is available through quit lines, nicotine replacement therapies, prescription medications, and support programs. The CDC's Tips from Former Smokers campaign and the National Quit Line, 1-800-QUIT-NOW or 1-800-QUIT-NOW are free and confidential resources.
If you're not here in the United States, go to your local or national resource page and find out what tips and available resources are in your area. People who don't smoke but live or work around tobacco smoke are also at an increased risk. Secondhand smoke causes thousands of lung cancer deaths each year among non-smokers.
That's why smoke-free policies in public places and at home make a real difference. Opening a window or running a fan isn't enough. The goal is to eliminate the exposure entirely.
The second leading cause of lung cancer in non-smokers is radon gas. And we've spoken about radon gas and have an episode about that if you want to go back to that. This is a naturally occurring radioactive gas that seeps up from the soil and rocks into buildings. It could be in your home, it could be in your business or your school. It's colorless, odorless, and tasteless.
Long-term exposure can damage lung tissue. The only way to know if your home has high radon levels is to test for it. Home test kits are inexpensive and available at most hardware stores.
If your home, work, or school does indicate that it has high or elevated levels, mitigation systems can help vent the gas outdoors. And this is a straightforward fix that can save many lives.
True. Certain jobs also increase the risk, particularly where people are exposed to asbestos, diesel exhaust, arsenic, chromium, or silica dust. Construction, mining, manufacturing, and shipyard work are higher risk environments.
I would think also individuals like firefighters might be at an increased risk.
True. Some of them wear
respirators.
Respirators, yeah.
Using protective equipment like respirators, ensuring good ventilation, and following workplace safety regulations help limit exposure. Employers are required to maintain safe air standards, and employees should never hesitate to ask for those readings.
Outdoor air pollution, especially fine particulate matter from vehicle exhaust and industrial emissions, also contributes. On days with poor air quality, it's wise to limit outdoor exertion, especially for those with lung or heart disease.
In recent years, wildfires have also, caused issues. So make sure you monitor what's going on in your area and see if it's healthy or safe for you to go outdoors. Some people have a genetic predisposition to lung cancer, even if they've never smoked or been exposed to other additional risk factors. Having a close relative who's also been diagnosed with lung cancer may actually double your risk of developing lung cancer.
And that's not destiny, but it does mean that screening may be worthwhile. In the next section, we're going to talk about who qualifies for early detection programs.
In addition to those preventative measures like using proper preventative, yes, a balanced diet rich in fruits and vegetables may offer protective effects thanks to antioxidants and phytochemicals that may help repair cellular damage.
However, studies show that high-dose vitamin supplements, especially beta-carotene, can increase lung cancer risk in smokers. So it's better to get your nutrient from whole foods rather than pills, unless directed by a physician.
Regular physical activity, maintaining a healthy weight, and limiting alcohol can also contribute to better lung function and immune function overall.
For high-risk individuals, screening saves lives. Here in the U.S., the Preventative Services Task Force recommends annual low-dose CT scans for adults age 50 to 80 who have a 20-pack a year smoking history and either still smoke or quit within the last 15 years.
Unlike regular x-rays, a low-dose CT scan can detect tiny nodules long before symptoms appear. Finding cancer early often means it can be surgically removed or respond well to treatment.
It's important to talk to your provider about whether you qualify and what the benefits and risks are, including potential false positives.
Broader preventative efforts like tobacco, like taxing tobacco, smoke-free laws, and radon awareness programs or campaigns have significantly reduced lung cancer rates in recent decades.
Continued education and access to cessation resources remain essential, especially for underserved populations where smoking rates remain high. So today we talked about what people can do to reduce cancer risk, quitting smoking, avoid secondhand smoke, testing for radon, reducing workplace and environmental exposures, and for those at higher risk, screening can catch a disease at a curable stage. Prevention isn't about fear, it's about empowerment. What? Empowerment.
Not entitlement.
Right.
No, but often it is about entitlement if you have the resources and the insurance to cover treatments. But I think before we wrap this episode up, we should discuss what's new in lung cancer research, what's on the horizon, the latest advances in early detection, treatments, and potential cures. For the next few minutes, we'll explore and talk about potential future. What's out there on the horizon?
Okay. We've covered what lung cancer is, how it's treated, and how to reduce risk. So now we're going to talk about discoveries and clinical trials that are giving doctors new tools and patients new hope.
As we mentioned earlier, early detection continues to be one of the most powerful ways of saving lives. Researchers are working to improve low-dose CT screenings by combining it with blood-based biomarkers, sometimes called a liquid biopsy, to detect lung cancer in its very earliest stages.
Right. These blood tests look for fragments of tumor DNA circulating in the bloodstream. If validated, they could detect lung cancer before a tumor is even visible on imaging. And also, we should talk about AI, right? I mean, that's one of the benefits of AI now. We're going to in a minute. Never mind. Some studies show that I almost stepped on you, Jean.
Mm-hmm.
Some studies show that liquid biopsies might also help determine if a treatment is working sooner than the scans can show.
There's also progress in artificial intelligence for CT image analysis. Algorithms can spot subtle patterns that human eyes might miss, reducing false positives and speeding up diagnosis and detection.
Right. Immunotherapy has revolutionized cancer care, but it still doesn't work for everyone. Researchers are now trying to figure out why not.
Some current trials are testing a combination of immunotherapy drugs and pairing them with targeted therapies to make them more effective. Others are developing personalized cancer vaccines, which will train the immune system to recognize tumor-specific proteins unique to that patient.
That's remarkable.
Mm-hmm.
Essentially, they're teaching the immune system to remember a patient's cancer so it can prevent reoccurrence. Several vaccine trials are showing early promise, especially for the non-small cell lung cancer.
Targeted therapies continue to expand as more genetic mutations are discovered. And we spoke a little bit about that and the treatment specifics to that.
Okay. Scientists are also exploring combination therapy sequencing, determining the best order to use the targeted drugs to delay resistance. As cancer cells mutate, they can adapt to one treatment. Alternating or combining drugs may overcome that.
Gene editing technologies like CRISPR are even being tested in early trials to modify immune cells, enhancing their ability to destroy cancer cells. It's still experimental, but it's it's on the frontier.
Advances aren't limited to drugs. Radiation oncology has become more precise than ever. Techniques like proton beam therapy can deliver high doses directly to the tumor while sparing nearby organs. reducing side effects.
And in surgery, as we mentioned earlier, robotic assisted systems give surgeons millimeter level precision. And this allows for smaller incision sites, faster recovery, and the ability to remove tumors that might not have been, or that might have been inoperable just a few decades ago.
Well, let's circle back to the liquid biopsies.
Okay.
These tests are being refined not just for detection, but for monitoring recurrence. If traces of tumor DNA rise again after treatment, doctors can act earlier.
And it's a step towards dynamic oncology, where treatment adjusts continuously based on real-time molecular feedback, not just based on scan results every few months.
The concept of precision medicine means using genetic, environmental, and lifestyle information to tailor care. Massive international databases now combine patient data to predict which therapy works best for which individuals.
And artificial intelligence or omics technology like genomics,
Proteomics?
proteomics,
I think so. Metabolomics?
a whole bunch of words we cannot pronounce,
Yeah.
are being integrated to identify new drug targets and reduce trial and error treatment approaches.
Prevention research continues too. Scientists are studying how long-term inflammation, air pollution, and diet interact with genetics to influence lung cancer risk. Understanding those mechanisms could lead to better preventive strategies.
And there's also work being done on chemo prevention, medications or supplements that might lower the risk in high-risk populations, such as statins to reduce like heart disease. So it's similar to that, but with cancers. So far, there's no preventative drug that has been proven safe and effective, but there are ongoing studies.
Well, in the past decade, lung cancer survival rates have improved dramatically thanks to earlier detection and newer therapies. The 5-year survival rate for non-small cell lung cancer has nearly doubled just since 2010.
And while small cell lung cancer remains challenging, clinical trials continue to bring incremental gains. Each discovery builds on the last, moving closer to chronic disease management or even potentially a cure.
For patients and families, hope now comes not just from the treatment, but from peace of mind and pace of innovation itself.
Mm-hmm. So lung cancer, as we said, comes in multiple forms, and each kind of behaves differently. Treatments have advanced far beyond chemotherapy. Prevention and screening also, it remains key to saving lives. And research continues to bring us closer to individualized care and one day, hopefully, potential cures.
For those living with lung cancer, the message is simple. Progress is real. Each year brings new options and more reasons to stay hopeful. Well, that wraps up today's episode of PodcastDX. Please visit us at our website, podcastdx.com, to learn more, and don't forget to follow us wherever you get your podcast.
And remember, this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment and before undertaking a new healthcare regime. Never disregard professional medical advice or delay in seeking it because of something you heard on this podcast.
Till next week.